Okay, this is part 2 of our nurse peer chart review training. So part 1 had our slide deck and a little bit of general information, timeline, things like that. So now I'm going to review a couple of PDFs that we have for you on the intranet. So this is the instruction sheet. It has a lot of great information, and it also has some forms in here for you. So we will go through this. So the purpose, of course, as we mentioned in part 1, we want to be the highest quality patient care that we can. And this is an appendix of a CHS medical quality assurance program. So it's a part of a larger program that we're doing to focus on quality assurance and just high quality services. So this is all the nuts and bolts that I went through a little bit in the slide deck. So 10 medical records every quarter or every 3 months for each nurse per program. So, and we have the different program areas: family planning, STI, TB, immunization, and newcomer health. The other programs are still in development. So you can read through this. So the documentation of findings. So we pulled these instructions from a lot of different places: agency policy, like the documentation by exception manual, nursing practice guidelines, and also consulted all of the other programs at central office, like TB, STI, Title 10, to make sure this was the best tool that we could provide for you. This does not replace, say, a Title 10 audit, but it should supplement it. So basically, if you're doing these chart reviews as you go, future things like 340B audit or Title 10 audit, or if the TB program comes, you should be doing all of the things that you need to do for those other programs. So to talk about the documentation, how you will document in here. So you'll enter the letter C for complete if the form or action was indicated and the documentation was complete and as accurate as possible. Like, yes, you did it. You'll put the letter I for incomplete if it was indicated, but it was sort of partial credit. Maybe you got the lot number, but you didn't indicate the site of injection, something like that. An ND for not done. So you needed to do it, but the documentation was just not there for that form or action. And then NA just wasn't indicated for this person, and you'll see a couple instances of that. There's also a big box to write comments. So if you want to explain yourself a little bit more, you don't feel like just an I is really getting across what you want to, there's some comment boxes. And then at the end of that, you'll save or print your piece of paper, and you'll go to this link here, which I'll show you in a second, and just fill out a summary of your findings. And this is just some general information. All entries should be in blue or black ink, legible, date and signed. Use the correct forms, and sticky notes. It should be documented in the form or in the chart. And then the form should be stored in a confidential file with the supervisor or the manager when they're all done. All right. So as I said, we've provided you lots of scaffolding, lots of instructions for each program. So that's just what I'm going to walk you through here. So you can see this when we're starting with this family planning and STI. Since our forms are combined, this tool is going to be combined for the two programs. All right, so this is a fillable PDF. So like I said, you can just be typing in here, and then at the end, you can just hit save. You can print it, whatever you need to do. So this would be the nurse reviewer. So this would be my name. And over here is my peer. So we'll say Santa. Okay. So each PDF or each program, you can go through 5 charts in one PDF. So this first box is for the WebVision IDs. You can see here. So I'm going to go through this whole thing for this person, this WebVision ID, one at a time, but then I can do all 5 on the same PDF. So I'm sort of just making these up. But you can see I can do 5 all in one tool. So the date. And then here are where I'm just going to put those little letters. So you can see for most of the programs, we've organized it by clip. So hopefully that makes it pretty intuitive. But like clip 1 is the CHSA 1A there and signed. Did they do income? Did they have a voter registration form? Did they fill out the CHS 1B if they got one of those? IUD next month. Again, this might be NA if they don't need it. But if they do need it, they got an IUD and they signed that, that should be a C for complete. So let's just say everybody did a great job. Okay. And then clip 2. So again, it's this pretty basic. It's did you document? Are all the forms there? Did you do everything you needed to do? Like we should have immunization records, even for STI and family planning. Are the allergies listed? Is everything up to date and initialed by the clinician? So, and then clip 3 are all the forms. But you can see if you scroll down a little bit, we have more in-depth instructions for you for each clip. So you can read special procedure signed. For clip 3, the general health history, you link to all of the in-depth instructions, the visit health history, and clinic visit record, all of that really in-depth information so that you can adequately say like, yes, this was complete, or no, this wasn't right. It's all there for you in the instruction page. So it goes line by line in that tool. There's a line telling you how it should be completed, when it's necessary, how documentation should occur. So I'll just scroll quickly to show you, but we have the same thing for TB. This we added, is it an active, a suspect, or latent? But then again, it goes by clip. So clip 1, all the registration documents. Clip 2, clip 3, clip 4, clip 5, clip 6, some general comments. And then again, we have really in-depth instructions for you for each item. So completed DOT logs. Are all of the previous month's DOT logs in the chart? Are they initial? Do they include the time, side effects, et cetera, et cetera? So just for an example here, where are my DOT? So I might put an I for this because if I have an active TB client, maybe I have the first 2 months DOT logs completed. We're now in month 4. The 3rd month DOT log didn't make it in the chart. So I'm going to put an I, and in my general comments, I'm going to say something that explains it. Prescriptions, yep, we got there. This summary of care. All that is great. For DOT, we have, again, latent and active in one form. So the DOT agreement, active N3HP. LTBI clients might not need that. So you can say NA. Same for VT. If this is a latent TB client, they're not going to need everything. Isolation agreement. If it's a latent TB client, it's not, and that's okay. But then on here, you might be reviewing an active TB chart, and then you would want to see those things. Okay, so again, we're doing 5 different charts back to back to back just to make it as easy for you as possible. So we have TB, again, lots of instructions, and then immunization. So again, 5 different immunization charts. This, of course, isn't exactly go clip by clip, but I tried to keep that same mentality. So registration documents, vaccine eligibility, and then the immunization encounter and administration. So did you give the right vaccine at the right interval, the correct funding, and did you document? Again, you have a big text box for more comments that might be needed. And then again, some instructions by line. Okay, our last program is Newcomer Health. So you can see this really closely mirrors the others by clip, but it's specific to all of the Newcomer Health documentation requirements. And we also have those instructions to help you line by line. Okay, and then the last is again the red cap summary. So once you have done all of those 10 charts and you hit save, this will go through how to submit the red cap. So this document is the whole instruction, the whole kit and caboodle. Again, I wanted to make it like as easy for you as possible. So I pulled out each program tool individually. So on the intranet, you will see, like if you are just doing immunization, you only really need this. And once you read the instructions once or twice, you don't need that whole thing. So this is just the immunization tool, the same for family planning STI, the same for TB. They're all just pulled out for you so that you can type, save, and then upload when you're all done. Okay, so that is the instruction page, the forms. Hold on for part 3.